push that you advocate for yourself and talk to your provider. It's such a common situation, and many of you may or may not know that you are experiencing fibroids. For me, myself, it was found on an ultrasound during a prenatal checkup. Salam and hello everyone, welcome back to the channel. I hope that you are all doing well. July is Fibroid Awareness Month, and it is a month where a spotlight is shed on a medical condition that impacts millions of women around the world. Now, some of you may have heard in the news recently, actress Lupita Nyong'o had to have 30 fibroids removed. So people like her are raising awareness about this medical condition and, really supporting the need for more research, more funding for this research, and a better understanding of why so many women, about 80% of Black women, for example, experience fibroids, including myself. Now, fibroids is a non-cancerous growth of the uterus and outside of the uterus that happens, and during that time, many women may not know they have fibroids, but they might experience some symptoms of fibroids, including gas, bloating, pelvic pain, and some women do experience infertility or fertility issues. And I know that many women have tried supplements and herbal recommendations, which I have even talked about vitamin D, for example, or BR-DIM to help with shrinking fibroids, or maybe changing up your diet and eliminating red meat, for example, and trying to exercise more to get within a balanced weight or a normal weight range, for example. But oftentimes what happens is women have exhausted all measures. We've tried so many things. We have done what we can in terms of homeopathic and holistic methods, which I support. Even as a pharmacist, I support trying these things if you are healthy and there are no issues that would prevent you from trying to take herbs and supplements. But with fibroids, you may have exhausted everything in terms of herbs and supplements and diet, and now you are considering a surgical route or a medication, a type of therapy, hormonal or non-hormonal, to try for the reduction of fibroids, or for the shrinkage of fibroids, or for the removal of fibroids, I should say. So in this video, what I really want to talk about are what surgical interventions are available for the reduction and the removal of fibroids, what hormonal therapies are available, and what non-hormonal therapies are available. It's going to be a very quick rundown of what these options are. And what I would advise you to do is, if you're not tracking your symptoms, track your symptoms for fibroids. I can leave a link to what those common symptoms are. And then I also want you to push and advocate for yourself with your provider, with your healthcare provider, whether it be your physician or your nurse practitioner. Talk to them about what you're experiencing and make sure that they know that you are in a category of women where fibroids is common. Even though the research doesn't really, it's hormonal, yes. Genetics plays a role. We know that women who have mothers or aunts or sisters with fibroids also are more likely to experience fibroids. And then we also know, I talked about diet, of course. That being said, let me jump into the 5 surgical interventions that are available, and then there are like 4 of the hormonal and non-hormonal interventions each that I want to run down for you, because I want you to be aware that there are options for you to treat and shrink fibroids, and that you should be aware of. So in the surgical intervention, the first is endometrial ablation, and this reduces endometrial thickness. The endometrial inside of the uterine lining gets thick, and that honestly helps to feed the fibroid. The second intervention is a uterine artery embolization. This reduces blood flow to the fibroid. So it cuts off blood flow directly to the fibroids. The third surgical intervention is a high-frequency MRI-guided focused ultrasound surgery, which reduces fibroid size. The third surgical intervention is a myomectomy, which removes the fibroid. And then the fifth surgical intervention is a hysterectomy, and that removes the uterus in its entirety. For hormonal interventions, I first want to talk about products such as mifepristone or ulipristal acetate. Now, these agents modulate progesterone to shrink fibroids. They are also known as SPRM, sperm selective progesterone receptor modulators. They are a class of drugs that interact with progesterone receptor in the body, exhibiting both agonist and antagonist properties, but essentially they are used in various gynecological conditions, especially uterine fibroid treatment, or in a situation where a woman is bleeding excessively due to menstrual bleeding. The second agent I want to talk about are combined oral contraceptives. I know there's some controversy over adding hormones to the mix. I have a correction to make. The potential benefits of oral contraceptives with fibroid-related symptoms include, number one, managing heavy menstrual bleeding, and number two, alleviating menstrual cramps. They may actually not shrink existing fibroids. And the third set of hormones I want to talk about are gonadotropin-releasing hormone antagonists. Many of you are aware of the hypothalamus pituitary axis, and specifically this causes the clamping down of the pituitary axis, so you don't see the production of FSH, follicle stimulating hormone, or LH, luteinizing hormone, which has a downstream effect of producing more estrogen and progesterone. So when you use an antagonist to block the pituitary gland, you essentially block the production of estrogen and progesterone. And this helps to shrink fibroids because you don't have estrogen and the high amounts of estrogen and progesterone. And then of course there's vitamin D, which may help to reduce the size of fibroids. And I talked about this in the future video, how agents like vitamin D, BR-DIM help to reduce the size, or may help to reduce the size of fibroids. When we talk about non-hormonal treatment, the first I want to talk about is tranexamic acid. Tranexamic acid reduces menstrual bleeding. Many of you know that menstrual bleeding is a real big problem with fibroids. It's hard to control your menstrual bleeding. Some of you might have been prescribed an IUD to help with the bleeding, but that is one of the agents that I wanted to bring up to you today. Maybe you have tried it, maybe you have not. Leave a comment in below if you ever tried tranexamic acid and how you've been faring on it. The next are NSAIDs, or non-steroid anti-inflammatory drugs, and this reduces menstrual bleeding. And the third non-hormonal agent I want to talk about is ECGC, or epigallocatechine. Now I talked about this before, and it's found in tea extracts, specifically green tea leaf extracts. And what this agent does is it may reduce fibroid size. As I've given you this quick summary with a list of surgical intervention, hormonal intervention, non-hormonal intervention, I still want to push that you advocate for yourself and talk to your provider. It's such a common situation, and many of you may or may not know that you are experiencing fibroids. For me, myself, it was found on an ultrasound during a prenatal checkup. So I want you all to really advocate for yourselves and do your best to, in the meantime, just take care of yourselves. Try to get your vitamin D, eat better. If it's leaving the red meat alone for a while, I know you can do it. If it's just trying to change up your dietary habits and just try to improve your life so that you can start to get yourself in the condition where, or prime yourself in the position and the condition where you're going to put your best foot forward and get the help you really need for battling fibroids, since it's such a common situation amongst women. So I hope this video has been very helpful for you. Let me know in the comments if you have any questions. Check out this video on fibroids here. Check out this video on fibroids here. And I thank you for watching, and I shall see you in the next video. Take care. Bye.